All right. Welcome back for another week at the Military Retirement Podcast. How are you doing, John?
Doing good, man. How you doing?
Oh, doing awesome, dude. Doing awesome. Oh man, what a week, man. I know I've been texting you throughout the week about stuff going on, trying to get things in place. Holy crap, man. It has I barely had time to breathe, to be honest, but I really look forward to our Sundays here, man. How's everything with you?
It's going good. We had a little bit of a gas problem, meaning gas for the stove and stuff like that. So there
Oh
was
wow.
a gas leak somewhere, maybe a kilometer up the road from us, not even too far away,
Yeah.
and basically a house exploded. So
Dang.
since that
Are you
happened,
okay?
if yeah, we're okay. Everything's good over here. The matter of
Okay.
fact, that day my wife was like, "Hey, don't go this way," and I'm like, "Yeah, it's on the other side of the house. I don't even go through there." But
Oh wow.
it was so that was like I guess everybody's okay and everything's
Yeah.
fine, but then they cordoned off like all the gas lines in the area. But
Hmm.
basically, like this half of the city has like no gas, and it's been I don't know, it's been a week, which is not too bad. I guess it's not horrible. It's not like it's snowing outside, so
Yeah, it's over here on my side, man. I mean, it's all over the news. People already
yeah.
know. I live in Southern California, close to the San Diego area or in the San Diego area. And man, the fires are roaring here. I mean, I put up a video on the Green Logbook about it. I could clearly see the mountaintop just in flames. So it was a little bit scary just finding out or figuring out what to do. There was like the fire department, like a week prior, in preparation for all this stuff, was giving out go bags filled with, just some equipment, right? Nothing big, just like little items, first aid kits and stuff like that. So we decided, since we didn't want to take from folks who may need it, we decided to grab one of our luggages and just make that into our go bag. So I went out to, like, Home Depot and got some masks. We bought a bunch of waters at the local store just in preparation. But it looks like it's expanding sideways, not actually coming up towards me where I am.
Yeah.
So I'm thankful for that. But it's still, it's a little scary to think that um, that's a possibility. And the air quality is terrible outside right now. But the good thing is, I don't know if you can hear it right now, but it's raining outside all
Nice.
week. No rain. Now it's raining, so hopefully that gives the firefighters, even up in LA, because when it rains here, usually it rains up in LA.
Yeah.
Hopefully, it gives them some relief from that.
Yeah, it's been a lot of crazy stuff in the news about the fires out there in LA and
Hmm.
the West Coast in general. And it's not like it doesn't happen every year, basically, but this year is a little bit worse than most of any of the other years because of the high winds and because of a couple of different um, pieces that like came together and made this confluence of a really, really huge disaster type
That's right.
environment.
Yeah, and I was reading online too, just why the firefighters cannot spray the area prior to any fires coming, like just in preparation, right? Maybe spray some of that fire retardant. And there's so much like red tape when it comes to like environmental and stuff like that.
Yeah.
Oh, we don't want to mess with, the endangered gophers, or I don't know what it is, right? But there's so much red tape out there.
Yeah.
It's incredible. I'm like, well, we're dealing with the livelihood of people. We're dealing with people's lives. Maybe want to take action prior to, in preparation of fires coming down our way. I don't know
Yeah.
too much about it. I just kind of read a little bit about it. Of course, that prompts me to educate myself a little bit more on these topics.
Yeah, actually, if you want to learn a lot more, I've been diving back into Tim Ferriss podcast, and Tim, this latest podcast has Chris Sacca back on the podcast, and Chris
Yeah.
Sacca runs a huge um, fund for alternative energy and clean energy and stuff
Hmm.
like that. And he was talking a lot about that, about how a lot of the activist groups and a lot of the people who are like, yeah, you can't burn down the forest and blah 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 because of the inhabitants of the forest and all that. It's like it's really yes, it's a good intent, but the repercussions on the back end of that are really like destructive as far as blocking the firefighters or whoever from doing that stuff, creating a lot of legislation in between, so you can't really actually take action and do things and
Yeah.
control the fire the way you normally would want to do it, like creating these like burn roads in between these kind of fire roads, in between the
Right. Yep.
fire
Fire
areas, so
breaks.
that you can
Yep.
contain it. And you can't really
Yeah.
do that in California. So, among other things.
Yeah. Yeah, it's a little. You would think that you could, right? Making like till the area around it, make fire breaks and stuff. Actually, when I was in up in Camp Pendleton, and there was a fire that just broke up over there in Camp Pendleton yesterday. I don't know what the status of it is. From what I saw yesterday, it was half an acre when it started. But all over the place, they've got fire breaks all over the place. People usually use them as like running trails and stuff, but they're all over the mountains because over here in Southern California, it's just a bunch of dry brush right around the mountain areas. So that's a problem, but it's also the fact that we don't have enough water here or don't get enough rainwater, right? If you were living in Washington State or something like that, you wouldn't have the issue. It'd be nice and green and wet all the time. But here it's once in a blue moon it starts to rain. So yeah, it definitely gives me
Yeah,
some things to educate myself on.
check my audio real quick.
Absolutely. So, so John, I wanted to talk a little bit about another form of craziness that we're going through right now, and I know that you are working on the federal side as well as I am as well. Um, Talking about how everything is getting impacted due to executive orders coming out, right? With back to work or the hiring freeze. It's kind of insane right now, and everybody, at least one, some folks that I read online, like they literally like had a job offer and all of a sudden stop, like, sorry,
Rescinded.
we
Yeah.
cannot provide you this job. The one dude I was reading about on one of the Facebook groups, he's like, hey, I've been applying for a job in this series for like 5 years. And he
Hmm.
finally got a job offer and an interview and all that stuff. And they accepted the job offer. And lo and behold, they took it away because of the hiring freeze, because he didn't get that final job offer yet. And I want to, it's for one, it's crazy to me. For two, I'm thankful that we are in our positions where that we're in right now. But I want to see like how possibly it may have impacted you, or do you see it impacting folks on your side?
Yeah, I mean, I haven't seen directly the effects of it, and luckily, the position I'm in is a NAF position. I don't think we have the same kind of hiring freeze penalties and things like that. With
Hmm.
NAF, it's a little bit different because it's a different pot of money.
Right, right.
It's still government civilian, but it's a different kind of government civilian under a different funding code. So I haven't personally seen the effects of it, but yeah, I've been looking all over the place and reading a lot of Reddit online, and
Hmm.
not only that, just some of these executive orders that have come out, immediately after President Trump took office. I've seen a lot of email traffic about the DEI. I think it's the DEIA or D.
DEI, right.
Yeah. So I've seen a lot of email traffic about that, like cease and desists, and people
Hmm.
like tearing apart these organizations because of that executive order and doing as fast as possible, and also including in there like, hey, if you know this is going on or you see this still activated and you don't report it within 10 days, like you could be held liable and
Yeah, yeah, yeah.
under under penalty. So it's kind of crazy. It's a little bit nuts right now. But yeah, the job thing, I haven't seen it directly. I'm sure it'll start affecting us soon, because when you put a hiring freeze like that in place, right, you're really limiting people's. Like we just came off of the fiscal year change, right, in October. So
Hmm.
usually from October, about 3 to 6 months after that, they usually have some funding issues and continuing
Yep.
resolution and things like that that affect hiring. And now you've got an executive order in place that says, okay, cease and desist all hiring for
Hmm.
an undetermined amount of time, right? So that's going to be very, very interesting, especially overseas, because these positions have to rotate out. It's not like in the States where you can stay in a position for quite a long time. Like here,
Yeah,
they have a 5-year cap. So I don't know if
right.
it's going to affect the 5-year cap and extend people, if that's going to make things more difficult for the PCS people going back and forth. I don't know how
Mhm.
that's going to work out, but I'm sure it's going to affect it pretty heavily.
Yeah, not just that too, it's the remote workers. So
Yep.
folks are now expected to come back into work, right? According to these executive orders, as far as I'm reading them. Um, and that causes an issue, right? You may have somebody who's located in Tennessee who's supposed to be working in DC, and now they're required to come into work, and it throws everything for a loop. So I'm curious to see how this is all going to play out. It's still fresh. It's still going through the processes. Um, I'm just kind of sitting back and seeing how people react to this. It doesn't affect me too much. I live like just a few minutes from my place of work, so it's easy enough for me to go in there every so often. But for fully remote workers, I don't know how that's going to work. I'm curious to see how it's going to work, and hopefully, it doesn't affect too many people and their livelihoods.
Yeah.
Yeah.
Yeah. It's going to be interesting to watch and see and how it all unfolds.
Yeah.
But on the upside of that, on the opposite side of that, if you are Army is where I come from, and that's kind of my world. And I get a lot of emails and information through the Army channels now that I'm back on the wonderful DoD email system. If you are in the Army and you're interested in getting some information about TAP, the HRC command in Kentucky is going to be having a town hall meeting coming up. A couple of them, it looks like. Let me just throw this on screen real quick. So if you're looking to get some better information on TAP, the TAP process is how it works. This is a good thing to try to tune into. These town halls are held by Human Resources Command, which is the Army's human resources entity that handles all human resources across the board for Army Reserve, and Army National Guard. So if you're getting close to that time period or getting ready to start doing TAP, and you want to get some good information, some good updated information, maybe be able to inject some of your thoughts and ideas about things going on in the TAP world, the Transition Assistance Program. This might be something to look into. I can always drop the link, but it's basically going to be held on Teams. That's where it's going to be at. That's the QR code at the bottom. If you're interested in that, just drop us a note in chat and I can throw that information up there for anybody who's looking for it.
That's awesome, man. Yeah, I appreciate you putting that up there. Did you, so John, you want to get into our guest here? You want to
Yeah.
introduce this
So
man?
things we can control, right? Preventive maintenance. Usually
That's
we hear that term and we think we got to go to the motor pool and work on the trucks and change oil and check tire pressures. But there's preventive maintenance that we have to do with ourselves, right? As far as going to the dock, getting things checked, doing these over 40 things. If you're in that category of people like most of us are. And so our guest today is going to be focusing in on, amongst other things, eye health and vision health. And that's something that I don't think that most people talk about. I don't see it anywhere on the internet in any of the channels that I read or watch or listen to. So I'm happy to have Dr. Frank Forgnoni on today, coming from well, he's not at the 3rd Medical Command anymore, but that's where I met him at, the 3rd Medical Command in Atlanta, Georgia. And he's back with us today. So let's bring him up on stage.
Heck yeah.
Hey, John and Vic. Thanks for having me here. And actually, I'm still at the 3rd Medical Command.
Oh, you're still at the 3rd. Okay, good.
Yeah, I'm their division.
I thought I heard you say you weren't,
consultant.
but okay, perfect.
No problem. No problem.
All good.
Yeah.
All good.
And also the small world, John, we were talking about how, your dad was an optometrist also. So that's great connection there.
Yeah, it's funny how we met and then we started talking. I literally grew up in an optometry office, like literally remember being there when I was like 4, 5, 6 years old, sitting at the desk or sitting on my dad's lap or whatever, grinding lenses, like making eyeglasses and all that.
Writing prescriptions and all that.
Yeah.
As a 9-year-old.
That's neat. Awesome. Yeah. Put you to work early. That's great.
Oh, yeah.
Awesome.
Yeah. So I'm curious. So Dr. Frank, is that what we call you, or do we just call you?
Sure.
Frank?
Yeah, that's great. Awesome.
Okay,
Thanks.
okay.
No problem.
All right. Awesome. So please tell me, who is Dr. Frank Forgnoni?
Well, I'm an optometrist with like 29 years experience, but also just a God-fearing person, Christian. Thank God for everything and thankful to be here. Basically, with a lot of my patient care experience over the years, about a year ago, I kind of went into a different season of life where basically I'm focusing on the educational aspects online through books and other ways of reaching people, social media and a YouTube channel. And also recently ventured out into fiction writing to kind of keep my creative brain going and working more on the trifecta of inform, inspire, and now entertain people. So trying to just help people along the way.
Excellent, excellent. And you opened up some private practices as well, right? You're a reservist, and you opened up private practices. Is that correct?
Yes, sir. Yeah. So
Awesome.
basically, over the years, I had two that I started from scratch. And then over time, I was able to sell them, thankfully. So I had one in Delaware and one in South Carolina. So those experiences helped me with, on the business side to also have a little better understanding of what I'm doing now in the online business world, but also just kind of those skills that the military teaches, resiliency, hunt the good stuff, the stick-to-itiveness, interacting, well, staff and colleagues, and into what I'm doing now. My core value is the golden rule. You treat people the way you want to be treated, as Jesus taught. So I'm just trying to do that on a daily basis.
Excellent. So I'm curious, how about the books, right? So I know John and I we wrote something together. We put it up on Amazon, right?
Yeah, right.
It takes some time to write something like that, with constant going back and
Yes, sir.
forth, writing and editing, things like that.
Yes, sir.
So you went from or do you only write fiction books, or did you write something else like optometry based?
Yeah, I have some optometry-based ones, 4 nonfiction, called the Vision Collection. There's 2 geared more towards adults and 2 towards kids. The first one just recently published about 3 weeks ago, and the second one is coming up in maybe about a week or 2, and then the 2 kids books expected in about a month. But interestingly, yes, with the time frame, the first one actually took me about 10 years.
Really? Wow.
Unfortunately, most of that was my fault with procrastination. So that's a whole nother story there. But last year, I kind of put a fire under myself and had a good kind of come to Jesus meeting, and felt this was the next thing to do, and put a lot of effort, and I was able to finish that book that was just sitting there for a long time. And then with that momentum, and also, getting some software to help, like some writing programs and other things just to make things more efficient, was able to work on the other books that I have, and then carried over that momentum to then work on the fiction side. But the 4 Vision Collection books will most likely be the main part of my nonfiction. I don't actually plan on doing any more nonfiction. However, recently published my first fiction book in the genre of psychological thrillers, which is my favorite. And there's many more expected on that. I'm hoping, over 2 to 3 years to knock out quite a few fiction books.
And on the nonfiction side of the house, the 4 books that you're referring to, 2 for adults, 2 for kids, what is it that you want people to walk away with from those books, from both sides of the house, from the adult side and from the kids side of the house?
So one of the main things is my tagline or motto, which is better vision for better living. And what we're looking at is that vision is not necessarily a static thing. Often we take it for granted, but a lot of times we can improve vision. And also I highlight some of my subspecialty areas of vision therapy, light therapy, some topics that some people just literally may have never heard about. And also try to, inform, almost like public service announcements, like things that some people just may not be aware of. For instance, a child should have a formal vision exam by an eye doctor before they start school. So many people just think a basic screening somewhere, family doctor or school nurse, and, is good enough. And then I look into, like an analogy with dental, they have a great way of, focusing on the exams. We would all think it would be kind of ludicrous for a kid to walk into a school nurse and just get an annual dental screening. Parents would be like, forget that. We got dentists for that. But they don't connect that like hey, forget that eye screening. We have eye doctors for that. So trying to get that message out, and also on my website, endearingendeavors.com, I have a page dedicated just for resources so that people can go on there, spend lots of time understanding, lots of issues, most of which areas they may not have heard of, like I said, vision therapy. I actually have 4 links up there that actually give doctor locators of doctors nearest to them, and some of it involves international doctors who do that. So again, in this phase of my career, I'm not actually trying to come see me per se, because I'm not actually practicing in that mode. I don't actually have a physical office, but what I'm suggesting is that they can go to their doctor, their eye doctor who specializes in these things, and look into those kind of specialized exams. For instance, learning related disabilities, dyslexia, those kind of things. A lot of people don't make the connection of the vision, the actual tracking, focusing, eye coordination skills that are often not evaluated with a basic exam. Some patient has to go on for like advanced treatment and evaluation. And some of the books go into, or some of the topics are case reports of people's lives literally being changed, for the better. Some are adults, some are children. Of course, the earlier the better for everyone. And also, just going back on the military side, I was privileged to help some of our traumatic brain injured service members when I served for about 6 months at Fort Bragg, now Fort Liberty. And it was just a blessing to be part of that team. A lot of people look at, say the surgical team, or, the family docs, the physical occupational speech therapist, but they don't realize that there's also vision therapy. And, some of the circuitry in the brain, it's amazing, because you can get a blast injury or some other type of compression problem or other trauma, and that, shock wave goes through, and it can really disrupt the vision pathways. And some of the neurological science, has found that it's estimated that at least 50%, maybe as high as 80% of the circuitry in the brain is actually dedicated to vision. There's
Yeah,
no
well, I
other
believe that.
part of the brain that is more dominant in any single sense than vision. And again, often it's just not evaluated either at all, or thoroughly, or appropriately.
Yeah, I get that completely, because that's something that we as people, humans with vision, we rely so heavily on, right? I mean, we have these other
Yes.
senses, hearing and stuff,
Yeah.
and smell, but we rely so heavily on the vision portion. If we were
Yeah,
to
and that's a
lose
good
something like
point,
that,
because
yeah,
yeah, because vision, is the dominant sense for those, who are able to see. I mean, obviously, if you have a significant visual impairment or blind, obviously those other senses are going to kick in.
right,
But on a average daily environment, and again, that goes into things like our hobbies, our work, particularly with all the digital devices. Um, Again, like one of the things I mentioned, in my books, is just a simple rule of thumb. We call it the 20-20-20 rule. Every 20 minutes of working close, like on computers, just take a quick little 20-second break. Look across the room, relax your eyes for about 20 seconds. So 20 minutes of work, take a 20-second break, looking 20 feet or farther. So just trying to get some of that, information out there, help people.
Yeah, I don't think people take it, or haven't really sat down and taken it serious. And that's why I was happy to bring you on the show and talk about this kind of stuff, because it directly affects, like, not just veterans and people getting a little bit older and turning 40 or whatever, getting to that point where they have to start wearing glasses. Like myself, I just started wearing glasses like right at the end of my
Right.
military career,
I
which
gotcha.
is a little bit strange for me, because I've had
Yeah.
20/20 like really, really good vision the whole time.
Right.
But
Well, that's an
I
interesting point. Go ahead, I'm
no,
sorry.
go ahead. No, go
I
ahead.
was say, because actually one of the chapters I have is speaking of that. It's called presbyopia, which by derivation it means old eyes. I mean, because we got to think centuries ago when they came up with that word. If somebody hit 40 years old, that was almost the end of their life expectancy, you know.
Yep.
Thank God now we're closer to like 75 or something, you know. So they would
Yep.
start seeing their vision appear around 40, and maybe a year or two, you know, they kick off and they're like, well, I got old eyes. And but for now, you know, hopefully we're thinking it's like middle age or something, but it is such a rite of passage. You know, one of the things I mentioned is that it's the great equalizer. You know, you live long enough and there's going to be something going on, and often that's going to be your eyes. And that brings up a whole nother way of helping individuals, you know, different types of glasses, whatever. But the one thing I try to set expectations is just like, you know, I don't run as fast as I did now that I'm almost 54 than when I was, you know, 24. And your eyes just aren't going to be exactly the same, even with the best of technology. It's like, we're still not going to get it 100% to where you were when you were, you know, 20 years old.
Right. So I'm curious about your journey from, you know, in the military and how that all happened. So were you a doctor already, an optometrist, when you joined the Army Reserves, or is that something that the Army assisted with, or you went through a school through the Army? How's that work?
Yeah. So I direct commissioned in 2009, and I had received my doctorate in optometry in 1996. So I was out about 13 years, and thank God I'd already had my student loans paid off for about 10 years. Did that, and so no, the military didn't, like, you know, pay for my education or anything like that, but they have been generous with particularly optometrists, which tend to be a sought after yet, you know, small amount of people. And particularly during the war on terror, there was a lot of shortages. So definitely, you know, there were incentives, you know, to join sign-on bonuses as well as retention bonuses. So I'm very thankful for that. But yes, I joined after I already had my doctorate and was already in my second office. So I had, you know, that business experience up in Delaware and all that stuff. Came back to South Carolina and then joined. And then another small world. I know we were talking about the small world experience. One of my roommates from optometry school, okay, that I just, you know, hardly saw for like 20 years or so. We end up in the very same unit at Fort Jackson, you know, in Columbia, South Carolina, as optometrists, and we had just joined maybe within, you know, maybe 10 months of each other, and it was just such a great, you know, time to have that, you know,
Yeah.
camaraderie and everything together, and then to, you know, serve together. But one other interesting thing on the military side with the outreaches that we do, a lot of people haven't heard of the Innovative Readiness Training, IRTs. I don't know if people heard of that, but basically it's like humanitarian assistance in the U.S. Or territories of the U.S., like Puerto Rico, other places. And what we do is we set up medical, dental, you know, optometry services, like say at a college or something that's not being used, or part of a dorm in a or the facilities of a high school during the summer for our annual training. And these communities, they compete for grant money from the DoD to have us come in. So it's a process. And then a lot of times the health providers can do that, as well as support staff. So, you know, one message, you know, just to maybe encourage people to look into it, is even though it's medically based, we need a lot of help behind the scenes, you know, whether it's planners, you know, administrators, you know, things like that. So it's a fun opportunity to help our fellow, you know, Americans. And that, I believe the website, I think it's irt.gov, I believe. And that has been, you know, a great experience to help out. I've served on several of those, as well as helped plan some, and just a good thing. And we also have an international outreach similar to that called MedRets, where we go to other countries. I haven't participated in that, but I do hope to do that, you know, in the future. So just wanted to, you know, and interestingly, dental and optometry are always like super busy during these sites. I mean, it's amazing. Like the lines will go on. We have to literally have, you know, a mechanism to make sure we have it, you know, expectations, how many people we can see a day and all that, so that people aren't waiting and then turned around and have to come back the next day or something. But it's, you know, it's out there. A lot of people have, you know, significant needs, and sometimes until we get in these communities that are, you know, financially, you know, disadvantaged or whatever, we don't realize that, how much we can do to help, our fellow citizens of this country and other countries.
So Frank, I got a quick question for you. Regarding, I mean, you see both sides of the spectrum here. You see the civilian side of optometry. You see being in the Army, U.S. Army Reserves. You see the military side. What are, in your experience, what are the most common related issues you see amongst service members with regard to eye issues, and how do you address those?
Mhm. So I think with in the military, what's interesting is that we still with our early entrance medical assessments,
Hmm.
a lot of us are still under the impression that whatever happens during that screening process is good enough. So even when we do our PHAs, the annual physical health assessment, typically it's just a screening for the eyes. So one of the things that I try to do, particularly to fellow service members, colleagues that I come in contact, or if I have an opportunity of doing a presentation or something in the military, is to remind them that that is a good start, but they should still have an annual exam. And there are mechanisms if they, for instance, fail something during the PHA on the vision, whatever, they can be referred for that. But one of the things that occurred, I think about 3 years ago, is on the TRICARE Reserve Select, they gave service members the option to have a vision plan connected. So it's an add-on. I don't know how much it is exactly. But part of our TRICARE Reserve Select, we can get vision coverage for things. The other thing, just to kind of highlight, is that while we are in uniform, those glasses are part of our uniform. Okay, so there are specific things you have to have certain colors. They're basically like your bland colors. Like your black, brown, pewter. Things. There can't be any bling, no diamonds, nothing, and it can't be like red camouflage, things like that. Yeah, so sometimes I have to do some spot corrections, on individuals, and sometimes some of these individuals may be higher ranked than me, so but part of it is just that we don't always know, and some of the regulations, and although it's coming out more, I think about once a year, we're doing more about the vision regulations, getting the word out, but also little things like, for instance, you can have a symbol of a company on the temple of your glasses, but it needs to
Hmm.
be muted. As long as it's muted, you're good to go.
Mm.
So that's kind of one of the main things is that overlap both civilian as well as what do you call it?
The military
In
side.
military, excuse me. Then we have to be aware that the exams is where it's at. Don't just rely on the screenings. And with that, I might put my glasses on a little bit too.
Yeah. And Frank,
But
I got to believe that these things right here are affecting a lot of service members too. As I mean, even when I got out, last year, everybody's face was in these things, right? Like when you have some time off, just
yes,
like as you would any other, like a high school or a college, you're constantly on this thing, and it's like your nose is damn near touching the thing. I mean, there's an option on here, a setting where you can set it to where it's like it has to be like arm's length, or else
right.
it will shut off, or it won't let you look at the screen. So I have it set like that for me, for my own kids, right? But I mean, ever since do you see a lot of issues coming from this, and I like wear on the eye from service
Yeah,
members?
100%. Yeah, I'm glad you mentioned that. For all of us, this digital world we have. I mean, first is that 2020 rule I mentioned, but also the
Hmm.
importance of proper blue blockers. And I do get into this on my website, on the resources side, as well as some other aspects on my website. There are certain blue blockers that are better than others. And the other thing about blue blocking is that during the daytime hours, we don't need blue blocking. Actually, blue light is actually helpful for our circadian rhythms. It helps with some of our hormonal balances. And it's the first thing. If we can get some early morning sunlight, even a couple minutes or more,
Oh yeah.
you know, literally wakes our brain up. And so you don't want to block it. You don't want to have a UV, or excuse me, a blue block filter all day long. But particularly in the later afternoon, sunset, and evening, particularly evening when we are also, you know, using mostly just artificial lighting and everything, we should have high quality, you know, blue blockers on. And the ones that I have are a gradient where you can start out and it gets progressively more blocking as the time goes on. And that's a company that I recommend called Viva Rays.
Viva Rays.
But definitely, yeah,
Awesome.
but definitely the importance of, you know, blue blocking technology is important. And again, different elements during the different aspects of the day.
And for those folks that are getting close to the retirement, and specifically the retirement, I know there's people that transition out after, you know, 5 or 6 or 10 years or whatever. But those folks that have done 20, 25, 30 years in the military, is there anything that they can do in that last? Because if there was something I could have done prior to getting close to 40 and getting glasses, I know it's kind of an inevitable thing, but is there anything that we can do to try to prolong that process to keep our eyes healthy as long as possible so that we can prolong the process to getting to the point where we need glasses?
Yeah, it's another good question. Thanks for that. There's also a company that I recommend called Screen Fit. So going with the digital world, but it's a downloadable program that is actually home-based vision therapy. And that is helpful because there are different things we can do to strengthen, you know, the mechanics of our vision, such as when our eyes turn in, that's called convergence. There's a link also between convergence and accommodation. When we come into focus and our eyes, you know, behind our iris, they have to have muscles that will contract, and then as we look away, you know, they relax. So there are definitely exercises that can be done to help improve our vision, and also, you know, kind of put off that age in which, you know, our vision kind of collapses around 40 or 45. However, you know, there is going to come a time that, you know, typically, and it may be closer to 50, usually it's somewhere in the 40s, where we just need some assistance to help. And, you know, the other thing there is just to let people know that, you know, it's not a sign of weakness to get glasses or to need some help. You know, it's just a part of the body that typically as we age, it just, you know, loses some function, and we just need to, you know, supplement, you know, as much as we can. There also are contact lenses that are made now to help with, you know, the refocusing ability. Um, as people get older, or for other reasons, if they need cataract surgery where there's like clouding in the eye, they can literally take that lens out. They can put an artificial lens in that's kind of like a contact lens, but it's permanent.
Hmm.
And they
Hmm.
have mechanisms now where it can help with the distance, intermediate, and reading. Although going back to what I had mentioned earlier, it's not going to be the same thing as when you're 20 years old. You know, some people may still need some form of glasses to help them, but that type of what we call multifocal implant will still assist them with some of their basic reading. But if it's super fine print for a long time, they still might need to wear, you know, glasses. And that kind of segues into that whole concept of what we call multifocal, because, you know, particularly, you know, under 40, we kind of sometimes take it for granted that we can normally just focus at all distances, you know,
Hmm.
but again, typically over 40 with the presbyopia, we lose that near focus, and then it can take us a longer time to look away and to refocus. Or if you're looking
Right.
far away, it can take you longer time to get into focus on something close. So that whole concept is called multifocal, or the lens design called progressive, or no line bifocals, things like that. And one of the things I mentioned also in my book is that, you know, there's different types of progressives. There's like good, better, and best kind of thing, right? And also with time, technology has gotten better, right? I mean, just look at, you know, our phones, everything, right? There's upgrades, whatever. So sometimes somebody will come in and they had a bad experience from a family member or a friend like 10 or 15 years ago. And then they're just
Right.
like, I don't want those things. You know, they're just junk, whatever. I'm like, well, you know, they've gotten better, you know, and at least try them or whatever. Because then if not, if they say, no, I don't want that technology, then it really limits. Because then you either have
Hmm.
just reading, or you have a line like for distance and near, or you can have a trifocal that gives you that distance, intermediate, and near. But those lines can sometimes just get in the way and kind of cause like aberrations. So there's different pluses and minuses to the technology. But and then some people, it's interesting. And again, I have to realize that we're, as healthcare providers, we're there to serve them, give them the data to make the best decision. And sometimes their decision is absolutely not would be my decision, but I just have to honor that, hey, it's their decision. Like for instance, and getting back to even the screenings, like in the military, we can pass the vision with just 20/40. You're like, hey, it's good enough, right? You pass, like you got the green to go. But you're like 3 lines off from perfect. I mean, there's there's 20/30, there's 25, there's 20/20, in between 20/40, right? And it's like, you can see better, than, and particularly when it's a full exam, I'm talking to them, I'm like, hey, you don't have to walk around with blurry vision, but if you're happy walking around with a blurry vision, it's not affecting your function and you're, delighted, then absolutely just stay with it. You know what I mean? But, I just like to, kind of be a conduit of the information to, again, help them make the best decision they can make.
Yeah. Now, Frank, I'm going to take a quick question here from the audience. We had File 13. He put this up. What about video games? Most of us in our 40s still game, or does that affect it? Now, I will say, as a man who likes to sharpen my marksmanship skills, I often play duck hunt. So I'm very curious about this myself.
Awesome. That's a great question there, File 13. Appreciate that. Absolutely, the video games can be helpful for hand-eye coordination, just our brain circuitry, keeping us, active and alert, and it's all, fun stuff. I mean, I like to play them as well occasionally. I think basically it's just the demand, if it exceeds our abilities, where we may start getting headaches, or we may, have blurry vision, sometimes dry vision. If we, there's a phenomenon that, it's been studied where when we're really excited or interested and alert, a lot of times we just don't blink enough, right? So we will have, dryness. So occasionally, people will use artificial tears, sometimes before starting on their computers, or, maybe after an hour or something like that. But again, it goes back also to the 20-20-20 rule, which we mentioned, kind of just giving your eyes, a break, and certainly using, the computer games as a good, opportunity to just enjoy life. But just do it, with some of the knowledge that we don't want to overstrain our eyes. And also having a good blue blocker, particularly if it's in those late night hours. Like for instance, when I put on my blue blockers from Viva Rays, particularly before bedtime, it definitely helps me so that I am not over alert. It actually starts stimulating the melatonin, starts relaxing, and then I wake up, refreshed. Like I mentioned, I do have some information about that on my website as well.
Yeah, and we have a second question also from file 13 about eye surgery, and does the VA cover it? I don't know if you know the answer to this or not, but this is probably a really important question.
Yeah, it's a great one. Another great question. Thank you. They definitely will for medical necessity for cataract surgery. Absolutely. They don't, to my knowledge, anything like laser refractive surgery, because it's still considered, cosmetic. But anything that can be considered medical, definitely it's something that the VA, can look into. And a lot of times individuals, they may have other coverage from TRICARE Medical or Medicare, as an example, depending on how old they are or whatever. And you may have a provider that you may like personally, or a doctor that has maybe a better reputation, or somebody in your community. Certainly look into those resources of your own insurance, So like some of my patients over time, they definitely are very loyal to the VA. They only want to see their VA doctors, and that's perfect. Others are kind of the opposite, where they only want to see their private doctors. So whatever works, best for you. And also in the military, I believe if it's more of a permanent situation, like active duty, or one of the a mission, I believe that's over 6 months or something, it's possible for the service member to be covered for laser refractive surgery, and that's also command driven, has to be approved. And then, depending on the military treatment facility options as well.
Yeah. And then also that sounds like actually a good option if you're coming off of active duty, or you anticipate coming off active duty or retiring or coming out of uniform after a certain amount of time. It might be a good idea if you're thinking about laser surgery or LASIK to see if you can get that done prior to coming out of uniform. But just keep the caveat in mind, like that stuff doesn't last forever either, right? It's about every 10 years, 8 to 10 years, you have to update that surgery. It's in a lot of cases.
Yeah, it really depends also on how the surgery outcome was from the beginning. I thank God I had laser refractive surgery, about 20 years ago, and I'm still seeing 20/20 at distance.
Nice.
So my reading obviously is down with presbyopia, but some people are stable almost, for a lifetime. Other people, they may need an enhancement like a year or two later. So the other thing too, with the refractive state or the type of prescription the person has to begin with, makes also a big difference, like, and the age in which they are. Like, say for instance, a person who's under 40, so they have the ability to focus at all distance and everything, they can get laser refractive surgery and essentially have, maybe a couple decades where they don't need any glasses at all. Whereas if you have a nearsighted person, by definition, nearsighted means you can see up close. Sometimes over 40, you'll take your glasses off to still be able to see up close, because that distance prescription gets in the way until you get either the multifocal or the bifocal. But basically, a nearsighted person can actually, again, can see up close. So if you're over 40 and you get, laser vision correction surgery, one of the things that the providers are going to talk about is it's going to basically flip-flop you. So you're going to, if everything goes well, you're going to have like perfect distance vision, but then you're going to have bad vision basically, or fuzzy up close. Particularly, as you get over 50, because presbyopia gets worse with each passing year. So it's something that we, want to talk about. And in my, experiences, with laser vision correction, patients, different age categories, we want to definitely, remind people, of that as well. And then, another thing too, is just that going back to the expectation, no matter if we get surgery or other, special, glasses, whatever, it's still not going to be perfect. We're going to do as best as we can with the technology, that we can, help you with.
Right. And I'm on here on the VA site right now. And I mean, it doesn't give a lot of information with regard to the surgeries. It just has like vision care, and then will the VA cover the cost of eyeglasses? And it gives you kind of like a lot of information on when they will, when they won't, etc. Then it has some follow-on information. Where did I just see it? Did I just pass by it here? If you have vision or hearing loss, the VA will cover the cost of hearing aids. No, that's something different there. Here, low quality or low vision and rehab services. So they do offer something. It doesn't get specifically into surgery, but like vision enhancing devices and technologies, electronic reading machines, electronic mobility services, things like that. I know there's folks in like the civilian sector, like the federal civilian sector, who may use some of these to better do their jobs. I know I've seen some of those. So these are options. I assume that you'd have to talk directly with your optometrist to see or your VA optometrist to see what kind of services are available when it comes to surgery, whether it be like something, like you mentioned, Frank.
And that goes into the whole good category of low vision that I didn't mention today, although I do have some of that in my books. But some individuals have vision impairment where even with glasses, contacts, or surgery, they may still not see very well. So then we have to look into devices. It could be special types of microscopes, telescopes, things that just, lighted instruments to help them see better. And those are with a specialist in low vision. And some of the VA clinics are more specialized than others. But typically, even a family care provider, could initiate the referral for, eye care to the VA. And then from there, it will go to the doctors to evaluate. And then if they need to, they will refer you to a specialized VA clinic to help. Also, in my training as an optometry student, I had 2 different training rotations at VAs. When I was starting in my training area, it was when a lot of the first Gulf War people were coming back, in the early 90s and all. And so it was interesting to help them and to just have those experiences. And then just going back a little bit in my history, my dad is a Vietnam veteran of that era. Just looking at different things and being able to see different people at the VAs who've served over time, and thank God, there's still some World War II veterans, and just being able to interact with them is, just a blessing.
Absolutely.
And I got another question
here
for you. Hopefully we'll have more of these. This is good. Angela is asking about natural supplements as it pertains to vision and eye health. Is there anything that you've recommended, heard of, researched, thought about?
Yeah, it's a great question, Angela. Actually, my second book, which is coming out in about a week or so, it's called Vision and Holistic Health. I have a good amount of information there about, different types of natural foods, like your fruits, vegetables, and some other, supplements. Interestingly, lutein is one that we should be eating, like through our fruits and vegetables. Like, for instance, things that are yellow, orange, your red type fruits, vegetables, they have more lutein in it. There's also things called zeaxanthin, but also just kind of the main ones that we've heard about, like vitamin C, E, and zinc, your antioxidants, your all natural type based, areas, food and or supplements. I always try to get it through food as much as possible, but I think it's important to supplement when we need to. And then on that, it depends on, the individual manufacturers. I don't really get into, selling vitamins or anything like that, but I definitely encourage people to look into, getting the best quality vitamin if they feel they need it to help their diet.
Amazing. Yeah, that's a lot of it's funny because a lot of your external health and health issues and health problems, like a ton of that stems from things like sleep, of course, exercise, moving around, moving your muscles, getting some muscle movements, and also your eating, like how you eat really plays a huge part. Like you said in the beginning, like our vision is 50% or more of our sensory perception of the world. Like I feel like eating is also in that realm of 50% or more of your overall health and well-being. What you eat, how you consume, and when you consume, and things like that.
Yeah, you can't eat like crap and
100%.
expect to have your body function correctly, right?
Yeah, that's right. And interestingly, when I go into that title, Vision and Holistic Health, I like to use the term, holistic optometrist, which is basically looking at the total person and our total, health. So there's mind, spirit, and body. A lot of times we just overemphasize one of those, but to look at it as, a total of our wellness. And I know in the military, they're doing better too, with the GAT, the global assessment tool, where they're trying to look into, and they do talk about, they ask about spirituality, of course, our mental and our physical health. And I think that's, the important thing. Like, one of the things I try to remind myself, when I have a patient or something, they don't just roll in as an eyeball. They got the rest of their body, hooked onto them. You know what I'm saying? So, and
If
it's
they
good
did,
to,
we'd be
find
concerned.
out. Yeah, I know, right? And but it's like, but we sometimes, as like particularly specialists, whatever, you're like, I just got to look at your eyeballs. You know what I mean? It's like, well, we got to look at the person, where the eyeballs are attached to. You know what I'm saying? And you're right.
Absolutely.
I mean, diet is a huge part of it. Exercise. sleep, that again goes back to the whole blue blocking thing. I think a lot of people have disruptive sleep right now more than probably ever because of the digital devices, because the last thing they're usually doing while they're sleeping is they have this up against their nose, and that that bright light is
Right.
just not what they need. Again, we need the blue light and all that in the beginning of the day. We don't need it right before we're going to bed, and that can just really disrupt our brain waves and make for a bad sleeping time and waking up tired, fatigued, etc.
Oh, 100%. 100%. We have another question. Angela, you're on a roll. Thank you for this. Angela Engel, do genetics play a part with vision? I'm curious about this too. Please, Dr. Frank, what do you got
Another
for
good
us?
question, Angela. Thank you. Absolutely, right? But it's that nature versus nurture, right? So absolutely, there are certain genetic issues. Like for instance, with Ehlers-Danlos syndrome, you have connective tissue disorders that are, genetically linked, right? So individuals with that may undergo like cataract surgery, perhaps if the elasticity gets to a point where the lens dislocates or other issues. There, are some elements to macular degeneration having, genetic effects, and there are, genetic markers that can be tested, things like that. But oftentimes it's just that delicate balance. It comes into also like even thinking of other things in our health. They call it like a dual hit hypothesis. I don't know if you've ever heard that before, but comes up into thinking of like cancer and other stuff where some people who would just say maybe have bad habits, but they never get cancer, and other people have great habits and they end up with some type of cancer. So basically, the dual hit hypothesis is that we have the environment, as well as the genetic factors. So yes, definitely genetics can impact the eyes. As what and that also goes into the family history as well. However, sometimes the family history may begin with you. You might be that first branch on the tree that has something, or you may have everybody in your family has a problem, but you may be the exception, and then you're good. So again, it's great to have the information, get the test data, then make your decisions on if you want a second opinion. That brings up a good point, by the way. Second opinions, if I can talk a second on that.
Absolutely.
Just important, because sometimes we just don't, vibe with the doctor we're going to. You know what I'm saying? Or that doctor may have a bad day, or you could have a bad day with that, and or you just don't agree with what they're saying. You're literally not picking up what they're putting down. It's like definitely go for a second opinion. And however, it should be a second opinion with somebody who has the expertise in what you're trying to seek. As an example, in my specialty area with vision therapy, basically like eye exercises, things like that to help, our eyes. A lot of times somebody will say, well, I'm going for a second opinion, but they're going with a second opinion to somebody who is not a vision therapy specialist, or they're going for a second opinion to somebody who's a surgical specialist. It's like, hey, surgical specialists are great, but they are not experts in non-surgical vision therapy, and that's one of the things I put in my first book that I published about 3 weeks ago, The Vision for All Ages. There's opticians who help out more like on the glasses, making those things like that. There are optometrists like myself and John's dad, that we do, evaluate and treat. However, we are not surgical specialists. Those are the ophthalmologists who are the surgical specialists. So there's kind of like the 3 O's: optician, optometrist, ophthalmologist. And we just have to realize when we're looking for a second opinion, find the right doctor. So for instance, if somebody's looking into vision therapy, again, on my resource page, my website, I have locators to help you find vision therapy providers.
John, can you bring the page up there real quick, John?
Yeah, absolutely. Hold on a second.
Just want to show, Frank, I just want to show the world, our
Thanks.
listeners, your
Awesome.
website here.
Appreciate that. Awesome. Thanks. That's fantastic.
So we have Endearing Endeavors. Yeah. Can you just kind of walk us through this and tell us where we can find these resources?
Yeah. So I put up different links. If you want to scroll down just a little bit, please.
Yep.
And basically, those are different hyperlinks there, different organizations. And the top 4 are set up to have the vision therapy locators built in. So when we click on, one of those, and then you put in, I guess, your state that you're in, and then it will enable you to find doctors who are nearest, to you. A lot of times it may take an hour or 2 drive, because vision therapy providers are still kind of far and few between. So, but it will definitely be worth that drive if you need that kind of treatment, because the beauty of vision therapy is that typically it may take 6 months, maybe a year to go through a program, but then typically it's done. So then you don't have to go back, like ever again. There may be just your basic annual exams, things like that, but not something that you have to do like forever. There's an end in sight. So also with my children's books, I'm trying to get that point across in a fun way, to realize that the importance of, hey, thanks for showing that. I appreciate that.
Yeah.
The importance of early intervention. Basically getting the eyes checked as early as possible. And if glasses are needed, or down the road contact lenses, or even surgery, it's okay. Those are just things we need to do to take care of our bodies. And the coloring book, still working on that, but we're going to highlight some of the fun pictures from the chapter book, The Vision for Kids, and we're going to make it interactive. We're going to try to get it as an electronic coloring book as well. Like book, we're going to look into that, but definitely that will be in a paperback, hardback copy, so they can have it in their hands. And then, if I may, I wanted to introduce our hero, Eli. He is our cute little plushie toy. This is my prototype. We're still working him out, but eventually, probably within 6 months or so, he'll be on Amazon as well. One of the cute things is that his bow tie comes off, and it can actually be used as a bookmarker. And Eli, he's Eli the elephant, and he likes to have his clothes on with our logo, because Endearing Endeavors has the same 2 initials as he does. And he even sports little cufflinks. So cute little guy. And so we're hoping that just encourages kids to learn more about their vision and have fun.
Yeah, it's a big thing. It definitely is. I mean, my kids wear glasses as well, and I was a little surprised when I took them in for the first time, after my son told me, "Hey, look, my eye's a little blurry," he said, when he was young. And I'm like, "Huh, let's go get you checked out." And
Right.
sure enough, he needed
Absolutely.
glasses. Yeah, so definitely good to know, especially with kids who don't know how to, I guess, express that, right? Like, my eyes a little blurry. Like, hey, look, can you
Yeah.
read this book? Check out Dr. Forgnoni's book. Can you read it, kid?
Right. Oh,
If you
yeah,
can't,
absolutely.
there's something going on.
Yeah, that's right. That's right. So there are specialists for kids too, pediatric
Yeah,
optometrist, and that's
that's
something
right.
also I've mentioned in the kids books as well, so that they know, sometimes if they have, a special problem, then they're going to go to a specialist in that area. But
Hmm.
as far as guidelines, there are national guidelines by our main national group called American Optometric Association, that a child should be examined, by an eye doctor first, like baseline, between 6 months and a year.
Okay.
So few eye doctors have those skills, but a lot of times we can bypass that if absolutely everything is healthy, and the initial pediatric exams are good, with the pediatrician. But what I really start looking at is the second recommendation, which is by around age 3. So right around there, then they're starting to be a little more verbal and other things. Although pediatric optometrists, do have training in nonverbal assessments, which also comes in handy with some of our special populations, and even people who may have suffered a really bad injury and can't speak as well anymore, and some other things.
Hmm.
We may need to do nonverbal testing. So basically, we have 6 months to a year for an exam is recommended by age 3, and then before they start formal education. So typically around kindergarten. So maybe around age 5 or so. So if everything was done according to those recommendations, by the time a kid hits school, they would have had, 2 to 3 eye exams by an eye doctor.
Right.
Now that rarely happens. And unfortunately, it usually happens later, when there's a problem or the child, tells you they can't see well. But I
Hmm.
still have seen a lot of people come in, as teenagers or even in their early 20s, sometimes later than that. And sometimes they'll be much older. They'll be like 40 or 50, and they'll be, they're real happy. They're like, this is my first exam. Like, I did good. I didn't need one. I'm like, well, yeah, but it's good to get evaluated,
Yeah.
because if you had something, we might have been able to treat it or just let you know if there's a, a baseline issue going on. Again, it's better to be preventative, before something gets, out of hand.
No, absolutely. If you're seeing the eye doctor for the first time after 50 years, I mean, something along the way didn't happen correctly, right?
Right, right.
Yeah.
Well, interesting. That's an interesting point. What kind of helped to motivate me and to give me a
Mhm.
passion, kind of for what I'm doing now. Because I hit some milestones. After around year 25, I got to about 100,000 patient encounters,
Oh, wow.
and I started hearing a lot of the same stories. And I will tell you, it was like I got to a point where I'm like, I either got to put this on some type of recording, what my answer is, or I should put it out into a book. You know what I mean? So it's like, and also the interesting thing there is it can be helpful to other eye doctors, to
Hmm.
have my books or to have their patients say, hey, research, Dr. Frank's books, and it goes into it and things like that, because we want them to get the knowledge. But sometimes, just the providers, it may be their 15th or 20th patients of the day, and they may be saying the exact same thing for that, that day, like 20 times. You know what I mean?
Right, right.
So basically just realizing that a lot of people, either they come in late for the exams, years go by, they don't know why they can't see, and some of them are just really, stressed. It's the first time in their life at age 45, 50 that they can't see up close. And then, believe me, sometimes they will think that they have a brain tumor. And, we have to, be empathetic and let them know that, this is the issue. Of course, if there is something else going on and we can do visual field
Hmm.
testing, because God forbid, it could be a brain tumor, but it normally
Right.
isn't. But what I have seen, unfortunately, is that if a person goes in with some type of a condition, just say headaches, for instance, and they go
Hmm.
to a non-eye doctor, a lot of times they're going to be misdiagnosed or over medicated, particularly
Right.
if they're in the age category of presbyopia. So if you're age 40 and up and you have headaches, especially after doing close work, computer work, reading, things like that, then you should have your eyes examined. You know what I mean? Because I have seen people in my own family who saw me later as a second opinion because they didn't, believe what the doctor, or didn't, agree with what they were saying, because
Hmm.
the doctor was going in the direction that it may be a brain tumor and that you have to go get a CAT scan and this and everything, and the anxiety and the
Wow.
cost
Yeah.
that can happen. I mean, I've literally seen people who've gone to, maybe like an urgent care or their family doctor for like migraines or other things. And then it goes on, and then they may see a neurologist and they may go through all this other special testing, special medication, and they've never seen an eye doctor. And then maybe 3 or 4 years later, they come in to see the eye doctor with all of this history going on. And then lo and behold, they needed reading glasses or they needed some type of bifocal, multifocal, and
Hmm.
the headaches would go away. And I'm thinking, all those years of anxiety, cost, that were wasted. You know what I'm saying? So that's, that motivated me also, kind of helped me, with this, passion to get people to understand this sooner than later, and to understand, different options, for their eyes, and
Right.
to get connected, with an eye doctor, like once a year, and the sooner the better.
Yeah, and along those lines, I want to ask, because I'm just curious myself, and I'm sure there's folks out there who are over the age of 40 who are experiencing some of these vision issues, maybe have to wear reading glasses for the first time, like myself. Um, as far as, and I know you mentioned it about bifocals and multifocals, um, and I want to get specific and nerdy about the lenses themselves, because coming from
Yeah.
like a photography camera kind of perspective that I'm thinking of. I know there's lenses out there for the camera that I can get that are, you know, $200, and then there's the same kind of lens with the same focal length with the same aperture that's like $2,000. And the difference between the two, I mean, one of the differences between the two is like the coatings on the lens itself. But I'm really, really super curious about the multifocal lenses. You said there was like good, better, and best. If you could tell me like what are 3 examples of that, and like I'm really trying to figure out what the best is so that I can look into that potentially in the future for myself, and maybe there's some folks out there who don't know all the ins and outs of glasses and how glass works and all that stuff.
Yeah, I appreciate that. Coming from the guy who was grinding glasses at age 9, right? So
That's
you
right.
probably have a lot better knowledge than most
Grinding
people,
glasses
right?
is not as hard as it looks. You just literally put the thing in there and hit the button.
I've heard stories where they've gotten destroyed in the process and had to get remade and all that fun stuff. But yeah, so you know, when I kind of generically just say, you know, good, better, best, I mean, it also comes down to, you know, the doctor you're seeing overall, and just a search, you know, for say progressives and, you know, top of the line. There's dozens and dozens of really good brands now. I mean, it's kind of you know, basically competitive market. So you know, without throwing, you know, proper names out there, I would just say that there should be good ratings, and to look for, you know, basically ask for, say, what is your top of the line, you know, because you know the doctors, the opticians, whoever's selling them, they know their tiers as well, you know, because there's price points too. I mean, because basically you're going to pay more to get better quality. But again, if it's something, you know, to help your function, you know, everything like that, then often it's a good use of money to spend on that investment. But basically, what we're looking at, like with a progressive, when you have a glass like this, you have an hourglass basically that builds in those optics. So these that I have are progressives. So my distance is up top, intermediate is more for like the computer range, and then the reading is down below with I'm looking down. And essentially, the better progressives will have a wider zone to give you as much, you know, periphery as you can. It'll have really good blend points so that you can move your eyes, you know, from like distance, intermediate, near, and not have any distortions or kind of squirrely vision or anything like that. And also like a little test when you're moving your head, you know, and you're just looking, there shouldn't be any swim. So, and sometimes it just depends where the best that's available at that point, you know, may actually not be the best thing for that person. Like, for instance, I remember with me, I tried what I thought was one of the best ones. You know, a representative comes in from an optical center or markets, whatever. You're like, I'll try it. And I had distortions. I had, you know, kind of dizzy vision, you know, just not feeling good. I'm like, gosh, I got to knock this down. Like, so I'm like, sometimes it just doesn't work. You know what I mean? So there's some trial and error to it. But I think if you can get to, you know, a good tier, you know, to the higher level, like, because when we talk about like a lower tier or just kind of, you know, subpar, it will still work, but it's literally using technology from like 10 to 20 years ago. It's like walking into a mobile store and still walking out with a flip phone. It's still going to make a call. It just doesn't have all the bells and whistles, you know, like a smartphone. So hopefully that will some of the information. Look at those cat-like reflexes as I caught my earbud. Look at that.
That was a good one.
Thank you. You know,
Those
so
good
you know,
lenses,
gotta
yeah.
have the hand-eye coordination going here.
That's right. That's right.
All right.
So we got a few questions here from the audience as well. So we got Bruce Daniel, who poses question. Says, "I've heard red light therapy can help. Any thoughts?"
So
Yes.
just before you answer, Doc, can I jump in there real quick?
Sure.
Just so you know, Bruce, I want to clarify: a red light therapy doesn't mean the place in Frankfurt downtown next to the train station.
Okay, I got you. Right, because you know, we're talking about, you know, we got to have the full body experience.
No, I had to throw that out there. Bruce,
The
Bruce
full body
is an old buddy of mine, so I recognize him. Yeah.
Oh, that sounds great. Yes. For instance, again, I do have this on my website. One of my pages is under affiliate marketing, where I have like 4 things that I recommend that I use. One of them is a piece of equipment from a company called Soul Shine. So soul like the sun, and then shine, Soul Shine. And I have it on my desk. And basically, it starts out like in the morning, like bright light therapy. So it's white light, full spectrum lighting. Particularly if it's just cloudy, dreary, overcast, rainy, whatever. Good, because I'm on sort of that spectrum of like seasonal affective disorder. If I go like a day or two without proper lighting, my mood changes and I'm just not a happy optometrist. But then at nighttime, this unit, it also has red light therapy. So I believe it's the only one in the world that in the same unit it can switch from bright light therapy to red light therapy. So it is good, for the eyes, and also red light therapy, for the body. There's a lot of things sold now, for, some people have like a face mask, a body, mask. Some of them are like sun, the UV full body things, but it's red light therapy. So yes, I definitely, believe in that. And also one of the links on my resource page gets into a company called College of Syntonic Optometry. And that involves light therapy as well as colored light therapy. So if we look at like a prism, when white light hits it and it spreads out into the colors of the rainbow, and that's kind of symbolic, where I used a double colored prism on my book covers, which is not in existence in nature, and it's not scientifically correct. But I did that as just an artistic expression of having rainbow light coming in, rainbow going out, but looking at the full spectrum. So we have frequencies of light. So, excuse me. Whereas like blue light is good, again, like early morning time, those spectrum colors. And then as we get towards the end of the day, we go into more of the amber and the red colors. And it goes back to just the circadian rhythms, and particularly before artificial lighting was invented. It would be, you get up when the sun's up, you go to bed pretty much, sun's down, you relax, maybe they lit a fire, put some candles on, and, those wavelengths are more, relaxing to us. So, I encourage you to look up that group, College of Syntonic Optometry. And also in my book coming up, The Vision and Holistic Health, I referenced them, and I had an article that I published with them years ago that I have in there as well. I actually call it Lighting Up, which has nothing to do with smoking though. Just about the colors.
These strange references, where do they come from?
Yes.
Yeah.
I know, right?
Red light
Exactly.
therapy, yeah. So
Exactly.
yeah, Dr. Frank, man, I've got this thing. So at my old job, right, I sat there at a desk, right? It was almost like a large office cubicle setting. And one of the things that I have going on with me is the fluorescent lights just kick my ass, man. They really do.
Yeah.
It gives me like headaches and all that. And I've heard from other folks that work in that, because there was a lot of military and veterans in that area, that they hate the fluorescent lights, right? Because it's a constant flicker, right? You can't really see it. So then I started looking into eyeglasses that could take away from that, right? Because I couldn't, if I lowered the lights down, it would lower the lights across all the office, right? And it was like one switch controlled one part, this large part of the office, the other one controlled the other part. So it was kind of a nuisance to deal with that. So I started looking into eyeglasses that had some kind of color or something to take away from that fluorescent light. And I came across a few things, but then I just started, they were kind of pricey and the insurance wouldn't cover it. And I'm like, you know what? I'm not going to pay out of pocket for this stuff. I'll just wear my sunglasses instead, right? In office. So I look like Ray Charles there typing, right?
Yeah.
And,
Right.
but I'm looking at, so you mentioned like Soul Shine, right? And again, we're not affiliated or anything like that or sponsored by this, but I'm looking at it. It looks like a sun kind of light, or it gives you that kind of sun exposure. Is that what it is? Like, for somebody that has issues with those fluorescent lights, how can we, I guess, change that so it doesn't affect us as much?
That's a great question. And if you're able to, I don't know if you edit later, but if you can plug the little YouTube clip with one of Tom Hanks' early movies called Joe versus the Volcano, and
That's a good one.
he talks about being under these fluorescents, and in one of the scenes he's like, "These things are killing me." It's like,
Yeah.
it's like he's like, they're sucking the life out of me,
Mhm.
and it's so true. I mean, interestingly, and the Europeans seem to be ahead of this than us, but there is a link of the mercury that is in some of these fluorescent tubes that is then being expressed into our light environment. There is a theory that when we get at some point, and maybe they don't have them as much now, but certain elements of vaccines have mercury in them, right? So when we get that in our body, it's still there. And then there's theories that say if you're under these fluorescent lights that emit mercury, it's like activating the mercury that you have in your body. And for some people, it could be a mechanism of cancer. Now, it's way beyond, my wheelhouse. I'm just saying what I've heard, and for people to do their own, due diligence and all that. But getting back to just kind of the basics with lighting, it is super important. If we can get, high quality, full spectrum lights, that includes any light that we have, from fluorescent to others, can typically be found in a full spectrum option, and that's healthier for us. And then, however, again, we have to be careful again in the evening time, sunset and beyond. We actually don't want to have full spectrum lighting. We want to like dim it down. If we could even get into, some type of like an amber light or something that mimics like candlelight, things like that. It's just easier on our whole body. But as far as tinting goes, sometimes a real mild blue or mixture of blue and green tint, like 5 or 10% on your glasses, can be helpful, just to kind of knock that out, as well as anti-glare. I'm a big proponent of anti-glare. I think it's helpful. It knocks out the glare coming at you. It also decreases the reflections when you're trying to look out. There's light behind us, so glasses have those two planes of light that can be reflected, and typically about maybe 5 to 10% of our vision can be improved with a good anti-reflective coating. So yeah, it's definitely important when we're around fluorescent lighting.
So yeah, for the VA listening, so the VA does not give you anti-reflective eyeglasses, right? These are from the VA, and you can't see my eyes on here. You can see like John's eyes, right? But yeah, the VA does not give you that. I've asked them about it. They're like, yeah, we this is what we provide. Same as, when these are like military issued, these are about maybe 2 years old. And again, like not anti-reflective, right? So you can see the lights on there.
Yeah, but they're looking better, because they used to call them birth control glasses, but I think you need a backup plan.
And they're hard. Those are hard to
think,
find. Apparently those are like in style now and people want them and they're hard to find.
Right. Exactly. Yeah.
They're a cult classic.
Yeah.
And along the same lines of that, I know myself, like I also work in an environment where there's a lot of fluorescent lighting above. I have the option to turn it off. But I've found just haphazardly through doing the podcasts and learning about lighting and photography and cameras and lenses and all this stuff. I do have one LED panel that I have that literally just sits right above my desk. And that's the one that I kind of use pretty much throughout the day. And it's set at like 2800 Kelvin or maybe 3000 Kelvin or something like that, which is kind of a more of an amber kind of light. And if you start to go on the other side of the spectrum, you get into like the 4000, 5000, 6000 Kelvin lighting. That's the more white light or bluish white light. So that's something to pay attention to if you're, especially if just at your house, even if you've got lighting set up. Some lights that you can buy nowadays, the LED lighting, you can actually switch between the cool white blue, which is like a 5000, 6000 Kelvin light, and a more yellowish, orangish kind of light that's more on the 2500, 3000 spectrum of the light. So you can kind of tune those back and forth during the day. We did have one other question.
It's good.
And also, I just want to make sure we're paying attention to the time because I want to be respectful of your time. Another one from Angela regarding surgery and the benefits after 40. I think we kind of touched on this, but feel free to answer.
Yeah, I think basically looking at, the benefit versus the risk with any surgery at any age, with you and your providers, just to make sure that it's, worth the time, energy, and, money investment and good prognosis so that, the outcome, hopefully, with a good surgeon will be, close to 100%. But nothing's perfect. Just remember that.
Excellent. So, Dr. Frank, I want to ask you, what do you want folks to take away from this episode, from your appearance here, from your expertise? Anybody listening, what do you want folks to take away from this chat today?
Yeah. Well, thank you. I think looking at, kind of the motto, and excuse me, I'm getting a cough in here. I was working outside yesterday, and I think it's catching up with me today. But in any case, better vision for better living. That would be the main thing, is that we don't have to settle for vision that is subpar, and that often in the hands, excuse me, of a provider that does vision therapy, vision can be improved. Sometimes, it's beyond our control. There are disease mechanisms, etc. But you want to have that ruled out with a specialist who does vision therapy. And also to treat things early. Early intervention is key. Particularly kids, they should have their exams by an eye doctor before they start school.
Yeah, it's really interesting. I've seen it from both sides of the pond in the States and over in Europe. And as you mentioned, in Europe, there's a lot of things that they're doing that are a lot more advanced than in the States. I know in Germany, for example, they have their pass, so it's like a little passport booklet for kids. As soon as they're born, they get it, and they have intervals that start at like the first week, first 2 weeks, and then it goes to a month, and then 3 months, and then 6 months, and all the way up to their like, up into their like 10 years, 12 years old. Like it follows them all the way through, and that's where the exams happen for everything, for just general health, for vision, for osteopedic. Am I saying that right? With your feet,
Osteopathy,
all that different
the orthopedics,
curvature, and all that stuff, right? They track all that stuff from birth all the way through up to like 10 or 12 years old. They don't necessarily do that in the States, so it's good to catch that early. But then on the other side of that, you have to have people who have been trained and are accustomed to doing those kind of exams at those intervals in the child's development, right? So even for care, generally they don't start till 1 or 2 or 3 years, in depending on the situation, I would say.
Yeah, and that goes back to another good point, just to kind of reiterate that you got to be careful which specialist you're seeing. Okay. So if you have a child who has a learning problem and you want to rule out if vision is the main problem, you don't want to go to an eye surgeon. Again, that's my opinion. It's the opinion of a lot of eye doctors, but I will tell you, it's not the opinion of the eye surgeons, because they, and I love the eye surgeons, when they do surgery, right? But there is a lane, right? Isn't it? Stay in your lane. You know what I'm saying? But, but the thing is that I have found through direct experiences that if some people who need a non-surgical solution are in the hands of a surgeon, they will often either not have the answer, or they will have a negative answer, which will go against even the option of vision therapy or something non-surgical. So, you have to be your best advocate for yourself, and especially for our kids and loved ones, So for instance, one of the cases of an adult that I helped with vision therapy, it's in the first book that I mentioned, they were 35 when they saw me, and they had gone to numerous different types of eye doctors. But it wasn't until she saw me that she realized that she needed vision therapy, and it dramatically changed her life. I mean, it was like a complete beginning of a total makeover in her life, because once she could literally see and focus and not have double vision and headaches, she went on to, get a better job, to be more outgoing, and it even, she was motivated to take care of her body more, exercise, which then helped, she was able to get off of like certain medications. And with her doctors, her doctors were like, "Hey, you're doing great," and all these are good, markers, all your results are come back good. So she was able to get titrated off numerous medicines that started with her functional improvements. So that's a word I didn't use too much, but basically functional improvements, improving what we can to make your life better. And there are foundational skills of vision, and there are more complex areas. There are things that we call, higher level vision skills, like say perception, like, visual memory, visual attention, but they all rely on the foundational skills, the basics, and then some of the other more complex areas like movement skills, tracking, coordination skills. And again, those levels of testing often need to have a vision therapy specialist to, help you with that. So again, be your best advocate. Don't necessarily take, no, as the answer, unless, it's truly based on, all the facts from the right person giving you that data.
Excellent. Excellent. Good. All great info. I really appreciate it, Dr. Frank. Man, this has been
I
eye-opening,
appreciate it too.
very informative.
Good.
Now I know, I mean, you've given me some links here that now I want to look into, some of that soul shine stuff and
Oh,
how to
cool.
best, I mean, I have an office, right? And with, again, fluorescent lights. So I just keep the lights off and some lamp in the back just to kind of give
Yeah,
me some light. So,
absolutely.
of course, I want to be able to see for the duration of my life. Right? So I got to take care
Oh,
of this stuff.
absolutely. Absolutely. Can I mention that one thing about the
Yeah.
VA thing with the long COVID that might be helpful to somebody out there? That's a
Go ahead.
personal note with me that so about 2 years ago, during just my active duty 2-week training, I came down with COVID. And about 6 months after that, I developed a serious heart condition, a type of cardiomyopathy that was leading into heart failure. And like today, to maintain it, I need to be on like 5 different medicines, but thank God, it's working, So I, started researching and whatever. And even though it is new to the VA, they're looking into, covering claims for what is considered long COVID if, 2 main things occur, which is you can document that you had COVID contracted on, like active duty orders or while you were doing official service, maybe as a reservist. And again, I don't have the exact, sentence, of from the VA, but basically, we have to have some proof that we were officially serving the military when we contracted COVID. And then my understanding from the research and things that are going on now with my claim in the VA is that if you came down with something serious, either new or if it was worsened or exacerbated, as they say, within a year of contracting the COVID, then it is, possible to get it covered by the VA as a claim for the condition. Like say, for instance, heart condition related to long COVID. So, and again, mine's still being processed. I actually had to go through an appeal and all that other stuff because it's so new. They're just not really used to it. But it's just worthwhile to, again, be your best advocate if that has happened.
Yeah,
and I just threw it up on
info.
the screen. If you just go out and Google long COVID VA, you can come to their site where they're doing the long COVID research. I think it says 11 studies on long-term COVID-19 outcomes funded by the VA that have coordinated coordination of plans, activities, and findings through the CORC. Studies aim to advance our understanding of the underlying mechanisms, epidemiology, diagnosis, and treatment of post-acute sequelae of COVID-19 infection. I hope I said all those words right, because those are some big words. I'm just starting to learn.
Yeah, very, yeah. Sequela. Yeah.
Yeah.
Well, that's good they're doing that. But just remember, there's also, I don't know if they have anything on there about actually making a claim as well. Not just studying you, but actually.
I'm sure you would get it through, just reaching out to one of these research centers or through this main site here. And I'm sure there's some stuff down here.
But yeah, this is all great info, because we don't know. I mean, people contract COVID. We don't know the long-term effects yet, and people are just starting to get those, those are still coming up to light, right? So that's good.
Right.
They're making the effort to allow you to actually put these as a VA claim and have it covered under the VA, because we don't know what's going to happen here 5 years from now, 10 years from now, from the effects of contracting COVID the first time around.
Yeah, and I appreciate you letting me get that word in. Hopefully that helps others.
Oh, absolutely. That's awesome.
As we mentioned, COVID itself can really affect us literally from head to toe.
Yeah.
I mean, there's like the brain fog. It can affect some mental things and of course physical things, joint pains and heart issues. Excuse me. So it's just good to know that the VA is definitely out there to help us, and hopefully they will, when those things come out where, you were on orders or you official duty, got something happen within a year, hopefully they'll make good on it and allow the, claims to be made, and then the help we need for, lifetime recovery, services, whatever.
Oh yeah. Oh yeah. So Dr. Frank Forgnoni, thank you for sharing your journey with us, your expertise. We've got your website on the chat there, endearingendeavors.com. It's all listed on there. If anybody wants to go on there and check out the books, the expertise, the resources on there, it's all on there for you. And you're also on LinkedIn, are you not?
Yes, sir. Yes.
Okay, awesome. So just look up Dr. Frank Forgnoni on LinkedIn, and you can find him on there, and maybe he can help you out and direct you to the best way to take care of your eye health. Really appreciate your time, Frank. I really appreciate it.
Thank you.
It's been a wealth of information on my side.
My pleasure. And John, I'm so glad that we were able to meet, and the third, for maybe a couple of years overlapped, and just a blessing. Glad you're having a lot of fun there in Italy now. All the best. And,
thanks,
Vic,
guys. It was really great to be able to meet you, and we had a lot of good long conversations, side quests outside of doing drill weekend and things like that. So
definitely. A lot of heart to heart. It's good. And Vic, thank you so much. Just your professionalism and just fun interaction and everything. I really appreciate it. It's been a blessing, and who knows, maybe a year or two, might invite me back. I'd appreciate it. We'll see how it all works out.
Absolutely. We'll do.
Well, you guys have a blessed day. Thanks so much.
Thanks, Frank.
Thank you. Bye-bye.
Dude, I mean, I always learn so much from our interactions from our guests, man, and this was no exception. I mean, a ton of stuff that I hadn't even known. I mean, again, we write things down all the time, right? Yeah. And I've got my notebook just full of stuff here on notes on things I need to look up now and fill my Amazon cart with, most likely, right? So yeah, again, always learning something. The 20-20-20 rule, I try to implement that all the time, right? There's a window right here, so I know I'm always staring at the screen, and it's good to look away from it every so often, because then you get the blurry vision. Nothing works well, right? And I've noticed over time, my prescription has gotten a little bit thicker. So I want to be able to see as long as possible. And,
Yeah, I think even beyond the scope of what we're talking about in the podcast here, like, is it Huberman, right? The Huberman?
Huberman Lab. Yep.
Yeah, Huberman Lab. I've seen a lot of his research as well. And that's kind of brought me kind of full circle back to, my interactions with Dr. Frank, and just thinking more about like vision health and vision impairments and how the vision actually affects your overall kind of health and your whole body experience. And then thinking about that from the perspective of veterans getting out after 5, 10, 20, 30 years of service, and being in some of the not optimal conditions for protecting your eyes, like sandstorms and all kinds of chemical exposures that we have and all these things. So just kind of bring it full circle. And again, I don't think it's something that I've heard too many people talking about, at least from the military and the veteran perspective. So definitely good to get it out there and get some information on it. And if there's some updates in the future, then we'll come back and revisit this for sure.
Yeah, and I will put this out there real quick. I know we're not really sponsored by it, but kind of, sort of, right? So I went to the optometrist maybe about this was maybe 3-4 years ago, and I took off. I was still in uniform. Took off my cover and put it down, and he saw that I had my eyeglasses inside of my cover, and he was like, "What the heck is that?" And I had to explain to him, and he brought in like all the other optometrists, and he was like, "Have you all seen this thing?" So I'm going to share this with you. This is a little something that I created a while back while I was active duty. Here it's called. Let me bring it to the stage here. It's called Undercover Clip. Very easy little invention that I made. It goes inside the 8-point cover on Marine Corps and Navy covers. And it now holds like another set of ranks if you would like that. But it goes inside. There's a little pocket inside the 8-point cover, and it goes inside there. And it basically just holds your eyeglasses in place, sunglasses, eyeglasses, whatever. I simply made it because I had bought a new pair of sunglasses. I put them in my cargo pocket, and they got jumbled up with like a screw and some pennies or whatever I had in there, and it just destroyed my $200 pair of sunglasses. So I went and started drawing things up, and I created this thing, and it took me like 7 iterations and prototypes to make it. But then I made it, and it's working out well. I don't wear my cover anymore, but it does still sell. It works out well, and they carry it at Marine Corps exchanges worldwide and stuff like that in different tactical shops across the country. So it's a fun little product. If anybody is interested in carrying it, it works very well, very functional.
Yeah. Now, if I could get one of those to fit my everyday after the military service, that would be great, because I literally do the same thing with my glasses. I throw them in my pocket, and there's like pens and crap in there, and they're already scratched up. It's been like 2 weeks, 3 weeks I've had these glasses. It's crazy.
Yeah. So it's what is this? It's a kind of a work in progress, because I'm always looking to expand on this stuff, right? But literally, it's just, you see the little sticker on here every time I go to drink my stuff, Undercover Clip. And it's just very functional. It has served me well. I had the same one in my cover for I don't know how long, maybe a year or two. And I make them all here in-house in my garage. I have a little workshop out here, so they're very fun to make, and they're made in the USA. The best way to carry your eyewear in uniform if you're in the Navy and Marine Corps, because it only really works with the 8-point covers for the moment. So fun stuff. Always keeping the brain going, right? Always keeping the brain going.
You're going to expand that out to the Air Force and the Army one of these days, or no?
So when I was out in Hawaii, there was like a little Air Force, like an AFES shop and like a uniform shop. So I bought an Air Force cover and an Army cover, and the Army one just has a big old pocket that goes inside, right?
The map flap.
Yeah. So I'm like, what the hell can I do with this, right? So it's tough in that I wish I had one here. It's tough in that I would have to create something that went through the entire top of it. I got questions about it. I got some prototypes on it. It never really worked out too well. It just worked out really well with these 2 covers, the 8-point covers, because there's a little pocket.
Real estate.
Yeah, little pocket in there, and it's just it took me a long time to make it, man. Maybe like 6 months, just doing like different dimensions to like the millimeter, but I got it to the point where it would fit anything from a small to an XL cover. So we there's was a Navy cop. The Air Force sets their glasses on the side table next to their recliner. next to the yeah, I hear that. Next to the lazy boy they get issued at when they finish boot camp. Nah, I'm just kidding. My wife is prior Air Force, so I give her crap about it all the time. But yeah, and the Air Force one, their cover doesn't even have it in any pockets unless they change their uniform. But I bought one of those, and I'm like, well, I can't really do anything with this. So, it's just a fun little product. I have fun making them. Showed my kids how to use, the prototyping software and all that stuff. So they have fun doing it, and then they make their own stuff. So happy to teach folks how to use that. But yeah, it works out well. Very functional. Very functional.
Yeah, man, it's awesome. It's really, really awesome. I really like it. And I like the fact that you still make them in-house and you still ship them from your house and all that stuff. That to me, that's
it,
impressive.
man. That's it. I still put the hang tags on one by one. There you go.
Nice.
I don't know if you can see it. Undercover clip. Keep your eyewear at the ready. So yeah, I physically everybody that buys one, I'm physically putting this stuff together here in my workshop. Fun
Beautiful.
to make.
Beautiful.
Very fun
Beautiful.
to make. Yeah, man. So
What else have we got? I got one thing I'll bring up just because it's time sensitive. I know we've mentioned Syracuse University multiple times for people doing PMP who want to do a PMP for basically for free. I think you went and did one of their cohorts as well and went through that kind of process. They did reach out and they were letting me know about a cybersecurity kind of thing that they've got going on based on the Data Privacy Week coming up this week, the 27th through the 31st. They are offering no-cost Google cybersecurity certificates for veterans, military spouses as part of the Onward to Opportunity, which we've mentioned multiple times on the podcast. So I'll just bring up like this key benefits kind of like quick rundown. If you're interested, just go to Syracuse University, look for the IVMF program, and they offer a bunch of no-cost training to military and veterans as well. But this one's specifically for cybersecurity and Google training. So if you're interested in that, some of the benefits, some of the cybersecurity stats of why it's important. It's a very big buzzword. And I know a lot of people that are coming out of the military, even if they're not in the cyber background, are kind of leaning towards that kind of a career field, whether you're trying to get that through college using the GI Bill or post 9/11 or the VRE program, or if you're just trying to do your thing on your own, or you're doing the Skill Bridge program to try to translate your skills over and get into that, get your foot in the door. This is another opportunity for those of you out there who are interested. So just check them out.
Awesome. Yeah. And with that, I'll say, we're going to be working hard on building some kind of relationship and collaboration with these type of cohorts. So if you're out there listening and you want to team up with us on the podcast, with the show, please shoot us an email, militaryretirementpodcast@gmail.com, and we'd be happy to team up and get the good word out to our audience and all military and veterans transition out from military to civilian as well. So very happy to team up.
We got 2 more comments, and then after that, that's all I got. Yep. We'll stop wasting the internet today.
All right, what do we got? Navy Cop, thanks, man. Nice. Power to the small business and side hustle people. Oh man, I love it. It's for the love of it, man. So if folks out there who have a side hustle and it really helps out the veteran community, I'd be happy to share it on the show, both on the Military Retirement Podcast and also on the Green Logbook as well. Be happy to give a shout out to small business folks out there who are doing the thing.
That's right. And the last comment of the day, referring to the cohorts at the IVMF up there at Syracuse University, getting the Six Sigma Yellow Belt. Wow, nice.
Very cool. Very cool.
Very cool.
Yeah, definitely good for business, right? Lean Six Sigma. Awesome.
Yeah, and for the Syracuse folks, if you're out there listening, or if you happen to be listening, or you happen to come across the podcast, as somebody obviously did for some reason, we are for sure starting to look for people to come on as sponsors. So if you're interested in sponsoring the podcast in any way, shape, or form, whether that be helping to fund some of the podcast, or coming on as an intern or a volunteer to help promote, build, edit videos, set up interviews, any of that stuff, we are definitely looking for some folks. We're not hiring anybody at the moment. We definitely don't have a budget for that. We're still building it out of our own two pockets, but we definitely are always looking for sponsors that can benefit the veteran community. We don't just want to bring on some like Geico or some craziness for no
Right.
seen reason. We want something, and we want to build a relationship with some folks that will then benefit every single one of you out there. Because otherwise, why would we bring them on as a sponsor? That would be just silliness.
Yep. Well, awesome. John, it's been awesome again. It's been great talking to folks out there and sharing some experiences, talking to Dr. Frank, and sharing all this good information. I know I learned something, and I hope folks out there did as well. With that, I think that is the podcast.
That's it. Thanks everybody for
All right.
listening, watching, paying attention, tuning in. If you like what we're doing and you want to support us, let the video run, hit the like button, hit the subscribe button, and we'll see you all next week.
All right. Out here.